Good morning, dear colleagues. It's an honor for me to speak today in front of you. And today, let me tell you about louder, okay. And today, let me tell you about amblyopia itself and our principles of treatment amblyopia. I'll start from a very beginning. So for those who don't maybe don't remember, amblyopia is a relatively common disorder, and it's a major cause of visual impairment in children. Usually, as in itself, it represents as an insult to the visual system, and during the critical sensitive period of development, whereby an ocular pathology interferes with normal cortical visual development. To say it easily, the brain favors the eye with a better vision, and at the same time starting to ignore the eye which is weaker. And so even when the glasses are worn, the vision won't get better on this amblyopic eye. According to American Academy of Ophthalmology, the prevalence of amblyopia in children all over the world is approximately from 3 to 5%. Any factor which decrease the central vision of the retina and somehow make it slower will lead to the amblyopia. And if its factor will affect the vision during the sensitive period when the child's visual system is developing. There are some kind of common factors, common causes of amblyopia. The most common one is refractive errors. It's called refractive amblyopia, and it has generally 3 types. Anisometropic amblyopia, it's usually unilateral amblyopia only on one eye, and it's caused by the distinct refractive error of each eye. For example, one eye with the normal vision and another one has a high hypermetropia, for example, +5, or in the opposite, it has myopia, -5, and the other one has a normal vision. Isometropic amblyopia happens when both eyes are amblyopic from a significant yet similar refractive error. This is, for example, when the child has from its birth high myopia on both eyes, or quite significant grades of astigmatism, or high hypermetropia. No, big pluses in his glasses. And the last one, meridional amblyopia, it occurs due to the difference between in the astigmatism between 2 eyes, and usually it's like a quite significant astigmatism. Less common but non-refractive causes of amblyopia is strabismic amblyopia. It's result from the suppression of the deviating eye. So in this case, the brain ignores the eye which is deviating to inwards, outwards on a vertical way, trying to because of the diplopia which this condition causing. Another one, it's less common, but the most severe form of amblyopia is deprivation amblyopia. It usually develops when the visual axis is obstructed due to some kind of diseases, congenital diseases. It's cataract, congenital cataract, cornea opacity, eyelid ptosis, and persistent hypoplastic primary vitreous body, and other ophthalmological diseases, even oncology of the eye. Before starting the treatment, the accurate diagnosis must be made. So before that, a child should undergo a comprehensive ophthalmological examination, which consists of refractometry, visual acuity test, binocular function must be assessed to measure the axial length of the eye, and of course to examine the anterior and posterior parts, segments of the eye, to see if there are any pathological changes. In case of amblyopia, we recommend to do high, precise, specific kind of examination, several of them. And one of them, and the most important, I guess, it's optical coherence tomography. It's non-invasive diagnostic procedure that allows us to see the layers of the retina, the tissue itself, and even its cells, even cells of the retina. Why is it so important? Because sometimes, even during fundus examination, at the early stages of diseases, especially inherited one, for example, retinal diseases, cone road dystrophies, or partial optic nerve atrophy, there might be no any findings while we will examine the fundus, while we'll examine the retina. But this kind of examination will help us to see it if there are any problems in the layers of retina. Also, for optical coherence tomography, which allows us to do a fundus photo, sometimes for small children, it takes less time and it's more easier to take a photo of the fundus of the retina than to ask a child to undergo the slit lamp fundus examination. And also this coherence tomography, it helps us already if we know some kind of diseases. If we know that in during the fundoscopy we found some lesions, some kind of dystrophies, we can assess it in monitor its condition, if it's progressive or not, if there any chance to cure this. So optical coherence tomography will answer these questions. The other one highly precise diagnostic method is visual evoked potentials and electroretinography. Both of them will also give us information about if there any problem in the visual system, even when a child is too small. It's according to visual evoked potential. So if you are not sure if their eye is able to see of your child, so visual evoked potential will answer these questions. So the main thing for the VEP that it shows us how the impact, how neurons or how the optical nerves are working, how the visual pathways are working, if they work properly or there is some problem there. According to electroretinography, it will show us if there are any diseases which also cannot be found even in OCT sometimes. So it's usually inherited dystrophies, and no, in this way there may be no even findings in fundus, in OCT, but the electroretinography will tell us about it. And one more specific examination is perimetry visual field analyzer, visual field examination. It's not for small kids. We usually do it when the kids is elder than 7 years old, but depends on the kid, of course, because it takes a lot of concentration and understanding of the procedure. Perimetry helps us to understand if there are any lesions during pathways that may affect visual field, especially when it's, for example, a lesion near chiasma or in pathways in the brain. And after doing all these previously mentioned examinations, we will making a concrete diagnosis and can make a treatment plan. About the principles of amblyopia treatment. First of all, the first step is early elimination of the cause of deprivation. So if it's kind of deprivation amblyopia, so we have congenital cataract or we have ptosis, corneal opacity. So firstly, it's surgical treatment, or it's a big angle of strabismus. It's the same. Surgical treatment at first must be done. If the problem if the cause of amblyopia is refractive error, so it must be done timely correct optical correction prescription. We need to prescribe correct glasses and another one when we have glasses, we eliminate the cause of deprivation. We are starting treatment. For treating, of course, we need an occlusion. We need to do the eye patching. And from patient, we need a compliance with occlusion of better seeing eye. And when we have all these steps, we can start the complex optic treatment during a sensitive period. Two words about occlusions. According to the latest data, eye patching of the better seeing eye should be 8 hours a day or even more, depending on the grade of vision loss. So 2 hours a day patching, 4 hours a day patching usually won't help to improve visual acuity on the amblyopic eye. The main purpose of occlusion is to make the poorly seeing eye work and eliminate the influence of the closed better seeing eye, which usually, when both eyes are opened, the better seeing eye suppresses visual impressions from the weaker eye. The amblyoptic treatment consists of several procedures. Day by day, during the 10 days, a child should visit a clinic. So he's in the glasses, he's doing the eye patching, he's coming to clinic and starting their procedures. Usually it's 3-4 courses a year, but it depends on how fast we can eliminate the amblyopia, how fast can we treat this. During the treatment, nurses always carried out the treatment plan, and the doctor is daily monitoring the treatment, the diagnostics, and doing the adjustments in the treatment course if it's needed. So the amblyoptic treatment consists of mostly physiotherapeutical, electrophysiological methods, and also methods that are aimed to stimulate the work of optic nerve, the work of macula. And now I will tell you about the devices that we have in our clinic, Crystal Vision, for which is in every treatment plan for amblyopia. The first one is the Amblyopia device. Its function based on an after image effect. Firstly, there is a blinding photostimulation, and then a child shifts his gaze to the black background and he sees the after image. The main thing that he is with his amblyopia eye, he is fixating on this picture which he sees on this device, so the central part of the retina, it's focused and it keeps unblinded. So this photostimulation is blinded the peripheral zone. And after that, he is continuing seeing the after image. It's resulting actually in foveal fixation and improved visual acuity, the central visual acuity. Generated therapeutic glare of retina. It's quite similar to the previous one, but here we blinded the whole retina, and light stimulation leads to increased activity of cells in the visual cortex of brain, and leads also to gradual improvement of visual function. Contrast frequency macular stimulation. This is a kind of specific stimulation of the central area of the retina of the macula. So if you see, they're quite familiar. We need to make the central part of the retina start working and stimulated it with different types of physiotherapeutic stimulating devices, and it stimulated the central area of the retina. It's called macula, and indirectly it's stimulating also a visual cortex of the brain with structural dynamic color stimuli. The color of the stimuli, it depends on the refraction. If the patient is myopic, mixed astigmatism or myopic astigmatism, it's a blue spectrum. And for hyperopia, hypermetropic astigmatism, it's a red spectrum. Also have computer optics treatments. They usually are in the form of arcade type games, so it's quite interesting for a child because he can do something during the treatment. So this is the kind of specific stimulation of visual functions and interesting game task, and they motivate child to complete the task, contribute the improvement of visual functions itself. The next one is stress cutaneous optic nerve stimulation. Actually, the mean of it is impact by means of pulsed electric current. It's quite low electric current, safe for every person. It's almost a child almost doesn't feel it. It works like activating nerve cells in the occipital part of the cerebral cortex where the visual cortex is placed, improve local regional blood flow, additionally accelerates metabolism. Also, it activates cells membrane to make they work properly. Electrophoresis. We use this type of treatment not only in amblyopia. It depends on medicines, medicinal substances that will be used during the treatment. So the effect the eye is of a direct electric current in its combination with administration of different medicinal substances through the skin or mucous membranes. So medicines enter the body through the intercellular spaces, sweat glands in the forms of, because of electrophoresis reaction, positive, negative particles, and its deposits in the periorbital tissue. And the result is improvement of metabolic processes, innovation, microcirculation. So it might be, it depends on which kind of medicine do we use. If we use something that vasodilators, yes, so we will increase microcirculation, metabolic processes. For example, in case if it's not amblyopic, sometimes in some kind of chronic diseases, we can use electrophoresis with the usage of antibiotics itself. If there some kind of, for example, deprivation, amblyopia, we can use some medicine that can resolve piperacillin, papain, crepazine, which can resolve some kind of opacities on the eye. Photomagnetic stimulation combines photostimulation of the retina with the red light magnetic stimulation of the visual pathways. In result, it has to improve processes in the visual pathway and has a stimulating effect on the nerves of retina, cerebral cortex, and leads to increased visual acuity. Also, I want to tell you about the development of our professor Igor Znevyan, which is called binocular optometric complex, or BOC, if it's shortened. We use it more than 15 years in crystal vision. The treatment on this kind of binocular optometric complex helps even when it seems to be impossible to treat amblyopia. So even when the visual acuity in patients like 1-2%, so mainly helps with some kind of inherited dystrophies, which are on the like when the central part of the retina is already significantly affected, when there is a partial optic nerve atrophy, quite significant also. And during performing this kind of treatment, we can objectively assess the state of visual functions in the real time. And the results of the treatment by BOC, the rehabilitation of patients increases by 4 times. It means like visual acuity increases by 4 times. For example, for patients who sees, for example, 1-2%, of course it won't be 100, but for them increases like from 2% in 4 times, so they see more than 10%. For them, it's very important. Binocular optometric complex, it works by means of biological feedback principle. It's implemented based on the visually evoked potentials, about which I told you previously. And we can predict the range of possible changes in visual functions during treatment because of this biological feedback. And also, we can stimulate the damaged channel. This is about the meridional amblyopia. The data of our retrospective study, which we've done. There took part 53 patients from 2020 to 2022, and they were divided into two groups: the myopic astigmatism, hypermetropic, mixed astigmatism. Meridian amblyopia, as I said previously, is amblyopia caused by significant astigmatism, and it's not so easily to treat, actually. And as you can see, during the treatment, have good improvement in visual acuity using this binocular optometric complex. Another one, development of our professor Igor Znevyan, it's the Strabo liquid crystal glasses. This is an electronic device. It's based on the intermittent shuttering of one of the lens. So actually, it's some kind of occlusion, but it's happened in these crystal liquid glasses. And it's periodical, so it enforces binocular visual exercises. For example, when your eyes is occluded the whole day, binocular vision won't in this way it won't there will be problems with binocular vision. So after doing the occlusion, after the performing amblyopia treatment, you will need another treatment to restore binocular functions. These intermediate periods, they force the amblyopic eye to function, develop the high visual acuity. If it's needed, the optical correction, the prescription of glasses, they may be implemented inside these Strabo glasses from its inner side. about this trouble liquid crystal glasses again, we conducted a study which the aim was to test the possibilities of using these glasses in the functional treatment of congenital partial optic nerve atrophy. And as a result, if you can see in the graphics, and the beta eye side, the beta eye, beta seeing eye, and on the weaker eye, in the result of wearing these glasses, of using them, the vision acuity increased. At the end of this speech, I want to tell that there are a lot of stereotypes, a lot of myth about amblyopia. There is in some age it's not treatable, and patients usually hear information that you can do nothing with this, your vision will stay the same as it's right now. So I want to say that amblyopia is not a verdict, and early treatment, early elimination of the deprivation cause of amblyopia, early prescripted, timely correct prescripted optical correction will help to avoid long-term problems with the child vision. Thank you for attention.